is Ruth Schroeder. I live at 92nd Street and Broadway on the Upper West Side of Manhattan. Well, originally we thought it was bursitis, and so I went to Dr. Duche, who is the hip person here, and I worked with him for a while. We realized it was much more than bursitis, but it was a whole kind of frozen, painful left leg that I couldn't walk on. I was in a wheelchair. I couldn't put any weight on it at all. Dr. Varma explained to me very clearly that we could wait a while and see if the leg was getting better. And he said we could wait and see if it got even better. But what he was concerned about was that there were some nerves that he thought might easily not respond because they hadn't been responding. And they would just get weaker. And when I went home and thought about what he said, I could identify precisely on my leg the ones that were getting better and the ones that were just not. They had just been kind of frozen on the left side of the left leg. And I thought, you know, this is just crazy. And we had seen the MRI at that point, so it showed very clearly this little bump coming out of the spine. And he said if he clipped that off, that would release the pressure on the nerve. Well, the reason I knew he cared and was engaged with it was because of the accuracy of what he said. You know, he'd obviously thought about it a lot. He had considered, you know, what was going on. And then he was also just very relaxed about the time frame. I mean, he was not in a rush. It's like, if you want to take a while, see if the leg clears up. I mean, after 2.5 months or something, it's like, I'm done waiting. But, you know, I appreciated that he wasn't kind of, we really should do this right away. That would scare me to death. I mean, and it wasn't that kind of situation. But I put the pressure on in the end because I just was like, yes, this is definitely what we need to do. Unbelievable. I hopped out of that bed. I didn't have any reaction to the anesthesia. I would never have known I'd had anesthesia, which astounded me. And I was absolutely fine. The incision was tiny. It was just above my waist, so it didn't catch pressure on anything. I would never have known I had surgery, to be quite honest. And I could walk better. You know, all those strange feelings in that left leg were gone. And I was given permission to walk all I wanted. So initially that was like, well, hallelujah, you know, walk, wow. Now after a few weeks, I'm like, what else can I do? I do a lot of exercise. I mean, I couldn't do that for a long, long time. And that finally, after the 6 weeks after surgery, I could cut loose and do all the, you know, classes and Pilates and Nia and all these different things I do that are just whole body movements that just get everything kind of working and flexible and so forth. So that's been huge. I mean, this last week, in fact, I just wear myself out to death, but I'm trying to moderate that because I just, you know, it's great to be able to do all these things.